Good evening, everyone. I'm Lavanya D, Assistant Professor and Clinical Psychologist in the Department of Psychiatry from Chettinad Hospital and Research Institute. The topic I'm going to cover on lifestyle and behavioral interventions in cognitive behavior therapy. The objective: understanding the importance of sleep, insomnia criteria, understanding on common lifestyle factors affect sleep, understanding behavioral intervention on sleep deprivation, understanding the comorbidities and associated disturbance with sleep, factors associated with insomnia, and evidence-based approach on regulating sleep cycle, that is with cognitive behavior therapy for insomnia, CBTI, sleep hygiene, grounding technique to improve sleep quality. The importance of sleep, um, the, uh, the complex biological process essential for health and energy. Sleep is very important. The causes for sleep are the multifactorial, and sleep regulates the period of wakefulness and the functions of body. Sleep promotes in healthy brain activity, producing new information and memory, physical restoration and healing, improves the metabolism and immunity. These The major factors for insomnia are multifactorial model, where it is formulated by the psychophysiological and behavioral construction, sharing the key components of hyperarousal and the insomnia due to high arousal of altered individuals in cognitive, physiological and psychological state that leads to sleep disturbance. The lack of quality of sleep brings the individuals with weakened immunity, cognitive deficit, fatigue, affects a problem in performance, mood and health in a person. Insomnia criteria: difficulty in falling asleep, difficulty staying asleep, early awakening, daytime impairment, fatigue, poor attention, concentration. Social or educational difficulty: when it comes to social or educational difficulty, I would say unable to perform in social cues or in educational performance have an impact on sleep. Mood disturbance or irritability due to lack of sleep, daytime sleepness, reduce the motivation or energy towards an activity or an event that an individual wanted to perform. And behavioral problems such as hyperactivity, impulsivity and or aggressiveness comes during the lack of sleep in insomnia. And ongoing worry about sleep also affects in the daytime impairment in the sleep. So the criteria that says for insomnia are occurring at least 3 times per week or at least 1 month. The common lifestyle factors that affect sleep, the negative factor that affect the sleep are increased screen time. The blue light suppress the melatonin, poor time management which makes the person to increase stress, secondary lifestyle and lack of exercise, irregular sleep schedule, caffeine, nicotine and alcohol use, and midnight cravings. I would say when it comes to negative factors that affect the sleep, all these factors are comorbid to each other, where due to secondary lifestyle, midnight cravings, or due to secondary lifestyle you may have increased caffeine or alcohol or nicotine use, and due to that midnight craving comes and you may have irregular sleep schedule, and because of irregular sleep schedule you may have stress. That stress may bring poor time management, and that brings increased screen timing and lack of exercise. This all comes together as a lifestyle factors that affects the sleep pattern of an individual. when it comes to behavioral intervention on sleep deprivation, the sleep deprivation has an impact on overall brain functioning, that is ability to remember or giving attention, emotional regulation, processing speed, concentrating on a particular event, and affecting on memory, processing speed. When it comes to memory, retaining memory and reprocessing it has a difficulty because our brain has been running throughout the time and the functions has been impaired. And due to this, the emotional regulation, when I say when it comes to emotional regulation, you have difficulty in giving attention, irritability may increase, or mood swings, or any other comorbid emotional irregulation may occur due to this factor. Then comorbidities and associated to insomnia are chronic medical conditions, which we are going to see this: circadian rhythm disorder, cancer, dermatological disorder, endocrine conditions like diabetic mellitus, menopause, thyroid, gastrointestinal problem, heartburn, gastrographic reflexes, cardiac condition, neurological diseases like dementia, pain related disorders. It can be a chronic or acute pain disorder, pulmonary diseases, restless leg syndrome, rheumatic diseases like arthritis, urological diseases. And these are the chronic medical condition that is associated with insomnia. And we also have psychiatric conditions in specific associated with insomnia, that is anxiety, depression, postpartum stress disorder. When it anxiety, individual may feel anxious for going to bed, or to sleep early, or having anxiety during the night time. Depression also have a symptoms of awaken for a longer period of time. And post-traumatic stress disorder has a part of insomnia where they think about the traumatic event that occurred in the past, that has been reprocessing in the memory again and again, and that has an impact on that individual. Then comes the substance abuse. Here, when it comes to substance abuse, people use alcohol, tobacco, and drugs. Increased use of alcohol, tobacco, and drugs may bring for insomnia, because they are being in the hyperarousal area. The factors associated to insomnia in a precipitating factor are alcohol and other substance use, chronic pain, divorce, separation or interpersonal relationship issues, financial instability, work-life balance, snoring, stressful life event, unemployment, and increased digital use. These are the precipitating factors that comorbid to insomnia, where they all interlink with each other. Due to increased digital use, they may have financial instability or increased alcohol use, or because of chronic pain there would be an interpersonal relationship issue, or financial instability of work-life balance, or stressful life events because of chronic pain, and that may bring a financial instability. And because of financial instability, the person may think to take alcohol or any other substance use, and this brings the interpersonal relationship problem in the family, divorce or separation, and other factors. And these all factors play an interrelated role when it comes to insomnia. When it comes to lifestyle modification for sleep, to promote a healthy lifestyle for sleep, you need to have these factors to make yourself better. Lifestyle modification for sleep, to promote healthy lifestyle for sleep, all these factors are going to be interrelated to each other. The first factor, that increase your physical activity, eat healthy diet, stress management, go low tech before sleep, exposure to natural light, regulate time management. When I say time management, you need to have sleep time, awaken time, and time schedule for sleeping and doing all your day-to-day task. When there is a with no time management, you may have a you may get into stress, and because of stress you may not have a proper appetite that may bring you to reduce your physical activities and less exposure to light and increase in your techie. That affects your day-to-day lifestyle for uh, deprivation in sleep. So these are the factors that you need to think to promote your lifestyle for sleep, healthy lifestyle for sleep. And here are the poor sleep hygiene, that the negative effect of poor sleep and behavior leads to what happens for an individual is lack of sleep brings fatigue, body pain, low mood, lack of time management, increased stress, poor processing speed, lack of attention, poor attention, low productivity, and these affects both physically and their lifestyle. The both behavioral disturbance and their lifestyle has been affected due to these factors. And behavioral intervention for sleep, you need to understand the do's and don'ts, where sleep hygiene is very important. Keep or create a quiet, dark, cool bedroom environment. When you keep a quiet, dark, cool bedroom environment, this helps the individual to sleep better and have a quality of sleep. When it comes to stimulus control, maintain a fixed sleep and wake time. When I say fixed sleep and wake time, the individual have to understand to make a regular sleep pattern to wake up and sleep. And relaxation training can be any type of breathing technique that an individual can follow. And cognitive restructuring, when it comes to do's in sleep, you need to understand don'ts is cognitive restructuring, where I will be telling in detail about the cognitive restructuring. The maladaptive belief system, that I will never sleep without a medicine, or reduce pre-sleep worry or rumination before going to sleep. And you need to understand, you need to here time management and limiting screen exposure before bed is very important in behavioral intervention for sleep. To improve your sleep, to improve sleep, things need to be avoided are naps during daytime. Stop using digital gadgets before 30 minutes going to bed. Avoid caffeine and nicotine at least 4 to 6 hours before sleep. Avoid alcohol. Bed is only for sleep. And do not use bed for watching television, eating, chatting, talking, and any discussion. Use your bed space only for sleeping. Keep your bedroom only for sleeping and don't use it for any other purposes. Use sleep diary to record your sleep time, awaken time, and other factors which I will be discussing you in the further slide. Have a regular exercise to improve your sleep pattern. Have a right place for sleep, and these are the things that will improve your sleep and the things you need to avoid during the for the sleep. The evidence-based approaches for sleep: cognitive behavior therapy for insomnia, that is CBTI, and we have stimulus control therapy. When it comes to cognitive behavior therapy for insomnia, here you need to understand the cognitive therapy have these factors that is helping others: cognitive restructuring, behavioral intervention on controlling method, relaxation technique the improving and changing the maladaptive behavior and restructuring the irrational thoughts. That is, I may have to sleep with a medication only, and behavioral intervention on sleep control method is having a proper physical exercise and relaxation technique. I will be teaching, and there are multiple relaxation technique that can help you to sleep better. And here the healthy pre-sleep habit are: keep your place clean, neat, without any disturbance. Keep your room little dark, calm, cool environment. Use your bed only for sleep. Avoid eating heavy foods in the night, and do not use digitals before going to sleep. And make sure your environment is calm and silent. This may help you to sleep and help your sleep cycle to be better. The CBTI component, that is cognitive behavior therapy for insomnia components, are stimulus control therapy associated with bed and sleep. Make sure you associate only bed is for sleep and not for anything else. And then cognitive therapy that challenging the dysfunctional belief that if I do this only, I will be able to sleep. If I use my phone in the night, I will be able to sleep well. Change that belief system. Learn to do relaxation training like breathing, mindfulness training, and relaxation techniques, which I will be telling you. And then we have the sleep hygiene education with a positive reinforcement. When I say positive reinforcement, good sleep will give you good memory, immunity, and to work productively. When you have lack of sleep, you may have fatigue, irritability, and lack of attention. So healthy sleep education will help you a positive reinforcement. And if you don't follow a healthy sleep pattern, you will have a negative reinforcement, that are the fatigue and other comorbid, which I have told earlier. Then comes the stimulus control therapy for sleep. The stimulus control therapy for sleep is a goal directed method which helps to control your mind and body. This is learned through the learned association method, which breaks the difficulty and helps to fall asleep, where the steps follows with consistent sleep schedule, creating a sleep constructive environment, following a sleep hygiene and cycle. You need to have a regular proper scheduled sleep time. Awaken time and sleep time should be fixed. And creating a sleep constructive environment is having a safe, clean, neat, tidy, calm environment, a dark calm environment to make a good sleep and hygiene sleep. And you follow the regular pattern will help you to sleep better. Here is the sleep diary which I wanted to tell you. This is the sleep diary is like a worksheet that can be useful way to have a good sleep cycle. Morning checklist: bedtime, rise time, estimated time to fall asleep, estimated number of awakeningness, amount of sleep obtained. When I say bedtime, you go to bed by 9 o'clock, but you sleep at 10, you fall asleep at 10 o'clock. So you note down the bedtime and estimated time to fall asleep, and number of awakening during the bedtime, and what time you wake up, and the quality of time you have been slept, so that you will be able to identify what is being related to the sleep disturbance and awakeness during the night time, and the quality of sleep you will be able to identify and work through it. And Here is a grounding technique for good sleep quality, that is 5 4 3 2 1. The grounding technique helps to focus on the present moment. 5. Safe, slight dark room that have soft, warm light to promote sleep. 4. Silent and still and focus in the room. Third, calm smell promotes sleep. 2. Touch and softness of your bed space. 1. Observe yourself and your breathing. So we all have all the senses at a one place, and with the focusing on your breathing to help to improve the quality of sleep. Let's have a small breathing session here. Just close your eyes and just take a deep breathe in and breathe out. You may be in a safe environment. I hope everyone uh, will be able to follow the instruction that I'm giving. Just close your eyes and just follow my instruction alone. You are in a safe, silent, calm, warm place. You are sitting comfortably. Just observe yourself, how you are sitting. Observe your breathing. Do a slow, deep breathe in and breathe out. Breathe in through your nose and breathe out through your mouth. Do a slow, deep breathe in and breathe out, and this will help you in a good quality of sleep. Just observe your breathing, how it's going in and how it's coming out, how you breathe in and how you breathe out. Just follow your breathing alone and your senses along with it. The soft texture of your seat that you're sitting, the silence, your breathing alone. Do this breathing for 7 to 14 times. You will be able to have a good breathing and a good sleep quality. Just only focus on yourself and your breathing alone. Just breathe in and breathe out. Breathe in through your nose and breathe out through your mouth for 7 to 14 times, and then take your time and open your eyes. You will have a fresh breathing and you may feel fresh. During sleep, you can follow this technique and that will help you good sleep quality. The take home message here, you would have learned the factors that affect the sleep and comorbidities and that associated with insomnia, lifestyle and behavioral modification to improve sleep hygiene, sleep diary, grounding technique for sleep with an evidence-based approach on sleep. These are my references for my thank you.